Next, from Chicago, Governor Rauner and members of the Illinois Department of Public Health hold a press conference to announce a new helpline to fight opioid abuse and help those suffering from opioid addiction. This runs about 35 minutes.
Okay, great. Good morning. Thank you for joining us. Illinois residents are suffering from a scourge. People across America are suffering from a scourge, and that is opioids, opioid abuse, opioid addiction. It is a tragedy. It is taking lives. It is destroying families. We've got to do everything we can to end this scourge and keep the people of Illinois safe. I want to thank Dr. Nirav Shah and his team at the Department of Public Health for the state. They have been working on this issue for more than a year, developing plans and taking actions. We formed an opioid task force to deal with this challenge, and that task force has laid out a very thoughtful, excellent plan, and they have been traveling the state, talking with community leaders, health leaders, law enforcement officers and others to implement the plan and get feedback on how we can coordinate, because this is a big team effort. We need the state working together with the federal government, working with local governments, local community leaders, local health professionals and law enforcement to end this scourge. We had almost 2,000 Illinois residents die from opioid overdoses last year. This is terrible, unacceptable. We have got to end this. Our goal is to reduce that number by at least a third in the next couple of years, and my personal goal is to end it completely. We have got to end this tragedy that is impacting so many people across the state of Illinois. Today, we are announcing the creation of an opioid hotline, basically an opioid helpline. So anyone can call in to get advice, get referrals, get access to treatment, so that they have one place to go, anyone in the state of Illinois, one place to call to quickly get the advice and recommendations and referrals you need to be able to deal with this horrible challenge. We are also very proud. We've had a standing order, and it's having a big impact. Standing order making naloxone available to anyone in the state without having to go through complex process, complex prescriptions and treatment. So because naloxone can save lives, and we need ready access, and I'm very proud of our team for creating that. It's readily available now. With that, for more detail on our progress, I will turn it over to Lieutenant Governor Sanguinetti. She and Dr. Nirav Shah have co-chaired our opioid task force and are making great strides, and I want to thank them for that. Lieutenant Governor Sanguinetti.
Thank you, Governor. Thank you. Good morning, everyone. It's a pleasure to see you all. As the governor stated, we've been working very hard across our state this past year, meeting with agency heads to combat this epidemic. We have some directors behind us, but I would submit to all of you that there are a lot of people, a lot of stakeholders that are very concerned about this, and we've been talking with them continuously throughout the course of this past year. As you know, the governor recently signed an order, and that order provided for a task force. The minute we had this task force created to prevent opioid overdoses, we hit the ground running, and we started traveling the state, doing field hearings in numerous locations. When I talk about field hearings, is that we first talk to families that have been afflicted by this opioid epidemic. Then we talk to law enforcement to find out what law enforcement is doing all across the state. And each and every day we find out that depending on the resources available, they could only do certain things. And this is very important to us because as we implement our action plan, we need to know the needs all across our state. I think we could all agree that all 102 counties here in Illinois were not created equal, and we need to see how they're dealing with this epidemic. We've also been hearing from the medical field, and they've been telling us exactly what they need and the sort of guidelines they need so that they could function appropriately. So as a backdrop, thus far, we've been to standing room only locations during these field hearings in Chicago, Champaign, Mount Vernon, Decatur, Dixon, Woodstock, Waukegan, Addison, Crystal Lake, Rockford, Rock Island, and Peoria so far. In other words, this has not been taken lightly, ladies and gentlemen. Now, we're also going to be scheduling more meetings, more hearings as the time progresses, because a lot of communities are very eager to tell us what they're doing. Now, everywhere we go, we learn something different. But we also know that we have our goals in place because we do have this plan and we're going to stick by it. And the plan is to curb the spread of this crisis by treating and promoting recovery for those suffering from opioid use disorder and averting opioid overdose deaths by 1/3 over the course of 3 years. So we are now implementing the tasks in our action plan. And today, as you know, we're going to be hearing about how we're implementing a few of those tasks. In October, IDPH issued a standing order for naloxone. It's also known as Narcan, and I call it the resuscitator because those who are experiencing an overdose could finally find help, but quickly. With the standing order now, people do not need an order. I got Narcan trained right away because we are now becoming our first responders in our communities. Also, too, we've established the opioid prescribing guidelines for medical professionals. Now, why is this important? Because our medical professionals want these guidelines. We want to make sure that the people that are getting opioids are using it appropriately and they're not getting a huge amount of opioids when they only need it for a mere few days. We really need to track that. And with these guidelines, we'll be able to do that. Finally, today, we launched the 24/7 helpline to assist those in crisis who are seeking immediate help. This is incredibly important because as I've traveled the state during these field hearings, a lot of people say there's still a stigma attached to this. And some people are simply too embarrassed to go seek help. And so how easy could it be to have this helpline to avoid that stigma and get on that plan to recovery? So our task force is extremely busy, will remain extremely busy because our families and the people in Illinois are so worth it. We're going to combat this epidemic because as you folks know, this epidemic knows no neighborhood, no color, no class. My friends, it is an equal opportunity aggressor, and we will beat it. So with us today, we also have James Demas. Director, please, the floor is yours. Thank you.
Thank you, Evelyn. No one starts misusing opioids because they want to become addicted. No one wants to put their lives or their family's lives at risk. No one chooses to have this disease. Even though we understand that addiction is a disease, as a society, we are still learning to treat it as a disease. Let me be frank. Stigma prevents us from treating addiction like the disease it is. It's estimated that nearly 250,000 Illinois residents are in need of some type of substance use disorder treatment, but are not receiving it. And stigma is a big reason why. Fear and shame of coming forward and seeking help is a very real and has very negative impact on people's chances for recovery. While stigma is an enormous barrier to people that need treatment, it's not the only barrier. Too often, people want help but don't know how to find it. Try doing an internet search of addiction or substance use treatment sometime. You get thousands of responses, and sifting through that information to find the kind of treatment that seems like it would fit you and might be available in your community can be overwhelming and confusing. To help Illinois residents find effective evidence-based treatment services, the Illinois Department of Human Services has been able to secure federal grant dollars from the Substance Abuse and Mental Health Services Administration to design and implement the Illinois Helpline for opioids and other substances. I'd like to recognize Doug O'Brien, who's here from our DHHS regional office, as well as Jeff Cody, who is here on behalf of SAMHSA from the regional office. We hope this helpline will improve access to treatment services, as well as to the medications that, when combined with counseling services, have proven to be effective in helping people on the path to long-term recovery. This is a resource that's going to be available to people statewide to help them with their substance use issues, including opioids and others as well. Thank you. I'd like to now turn it over to Dr. Nirav Shah, the Director of the Department of Public Health.
Thank you very much, Secretary Demas. Good morning, everyone. My name is Nirav Shah, and I'm the Director of the Illinois Department of Public Health. I'd like to thank everyone for being here today, particularly our partners and stakeholders that we work with every day on this crisis, as well as our federal colleagues and other state and local colleagues who are joining us here today as we launch the Illinois Helpline for Opioids and Other Substances. The administration began addressing the opioid crisis shortly after taking office, nearly 3 years ago now. And in that time, we have seen the number of overdose deaths increase exponentially. Since 2013, the number of heroin deaths in Illinois has more than doubled, and the number of just general opioid overdoses, deaths related to opioid overdoses, have more than quadrupled. Last year alone, nearly 2,000 individuals in Illinois died of a heroin or opioid-related death. For context, that is more than 1.5 times the number of all homicides that occurred across the state, and almost twice the number of fatal motor vehicle accidents that occurred across the entire state. Now, those numbers belie the actual true impact of the opioid crisis, not just on individuals, but on families and on communities. At least one survey estimates that 1 in 3 individuals across the state is somehow affected by the opioid crisis. 1 in 3. Think about that. Take a look to your left, take a look to your right. 1 of the 3 of you, in some way, either directly or indirectly through a family member or a friend, is thought to be impacted by the opioid crisis in some way. Now, as the Lieutenant Governor mentioned, as we've traveled around the state, we've heard firsthand how this crisis has affected individuals and communities. But at the same time, we've also heard inspiring stories of courage and compassion and resilience. And one theme shines through all of those stories: that recovery is possible. That recovery is indeed possible. But recovery requires 2 things. It requires hope, and it requires help. It requires hope, this belief that things will get better. Things can get better. With hard work, with dedication and perseverance, that there is a better vision of the world for individuals who are affected. But it also requires help. Overcoming a demon as difficult as substance use disorder is rarely something that can be done by oneself. And it's not a journey that anyone has to make alone. Help is available at every step along the way, including, perhaps most importantly, at the first step. That's why the helpline that we are unveiling today is so critical. Through 24-hour, 7-day-a-week access to the helpline and its wraparound services, individuals grappling with substance use disorders, or their friends, or their families, can call and receive counseling. They can be connected to resources and to ultimately start on their path to recovery. Now, we specifically structured our statewide opioid action plan around 3 pillars: prevention, treatment, and response. Today's helpline addresses all 3 squarely. It helps prevent individuals from becoming addicted in the first place. It helps connect those who are grappling with substance use disorder with treatment, and it helps in the immediate response so that individuals who are in jeopardy know where to go. Really is the classic situation where one intervention can address individuals grappling with this disease at all stages. I look forward to continuing the productive collaboration of more than 10 state agencies as we implement further the action plan and work toward our goal of reducing opioid deaths by 1/3 over the next 3 years. I'd like to thank the governor as well as the lieutenant governor for their dedication and support of this initiative, and I'd like to thank each of you for being here today. Thank you very much. I'd like to now turn the podium over to Mr. Luke Tomsha. Luke?
Good morning, everyone. My name is Luke Tomsha. I have an 8-year-old son, and I'm the second of 5 children from a working-class family in central Illinois. After my graduation from the University of Illinois in engineering in 2000, I became an active member of my community, working high-profile jobs, including as school tech director and an IT consultant to local businesses. I volunteered at the March of Dimes and moonlighted at my family's popular restaurant. What many didn't know was that I was addicted to heroin and prescription opiates. For over 14 years, I would make 3-hour round trips to inner-city Chicago in the middle of the night to get my medicine so I could avoid withdrawals and make it through the following workday. It was a rat race, and I became a slave to these drugs, too ashamed to seek the help that I desperately needed. It wasn't until my close friend and coworker Ryan Bukaki overdosed and died while I was in rehab 800 miles away that I decided to finally come forward with my story and face the stigma and shame that both myself and my family faced. Since then, I've been on a mission as one of the many voices and families of the children affected by the crisis. This past year, I started a nonprofit, the Perfectly Flawed Foundation, aimed at strengthening communities affected by substance abuse. Fortunately, my community has united behind these efforts, and this past month we raised over $102,000 at our first fundraiser. Our core goal is to provide the children affected by the crisis with exposure to extracurricular activities such as art, music, karate, yoga, and gymnastics. We hope to unlock their talents and guide them to a life that gives them purpose so they don't seek happiness in drugs and alcohol. I hope we can inspire others in their community to step up as well. Individuals need access to help, and this hotline is just a start to the many solutions that are needed. And I'm glad the state of Illinois is taking action. In the United States, over 140 families are losing loved ones each day due to the crisis, and the number of babies born addicted to opiates is soaring. In 2015 in the U.S., over 80,000 children went into foster care due to parental substance abuse. With all due respect, it is a cold, hard fact that young adults, including my 8-year-old son, have better odds surviving war in a foreign country than they do growing up around the dangers of the opioid crisis in their own backyards. This problem isn't going away on its own, and our children's lives are at risk. Please don't take this problem lightly. We must all step up to make a difference before our communities are destroyed from the inside. My continued condolences for the families who continue to lose loved ones. I'm in this fight for you. Thank you.
Thank you, Luke. Questions on this issue?
Governor, I noticed in the plan that there's not much of an effort to fight the large drug companies. For example, there's a growing national awareness that, for example, Purdue, the makers of OxyContin, are in large part to blame for aggressive salesmanship and pushing these drugs into the heart of America. In fact, some states' attorneys general have joined in class action lawsuits to try to combat this. Is this something you'd like to consider as part of your plan?
A number of jurisdictions are engaged in lawsuits on this issue. I think it's a good step. Our administration has focused on prescriptions and prescription-making guidelines and trying to encourage changes in the way these substances are prescribed. And maybe, Dr. Shaw, you might comment on that a little bit.
Thank you, Governor. One of the things that we know that is an entry point for individuals who find themselves grappling with a heroin disorder is a legal and valid prescription they receive from a physician. Although prescribing rates overall have come down just a bit in the last few years, they are still multifold higher than what they were even 10 or 15 years ago. One of our primary aims is to reduce the overall volume of prescribing, in a sense, to close the front door into the pathway that many folks find themselves grappling with addiction with.
Without enforcement of any kind, how would you actually make that
Well, there is the enforcement in this situation redounds to the physicians themselves. Indeed, the Department of Financial and Professional Regulation recently released guidelines that should inform how physicians prescribe opioids and in what settings opioids are applicable and for what duration. And coming as those do from the Department of Financial and Professional Regulation, they do have the impact of regulating physician behavior.
Dr. Shaw, what evidence do you have that it is having an effect upon the profession itself? I mean, doctors sometimes have a hard time turning down their patients and telling them, no, you shouldn't have that medicine you're asking.
You're right, sir. The dynamic that occurs in a physician's office between the patient and the doctor is a difficult one. And what we don't want to do is micromanage or overregulate that relationship to such a degree that individuals who really truly do need pain management find themselves on the short end of the stick. That's certainly not our goal. What evidence do we have? Well, we know what the CDC recommends. The CDC itself released prescribing guidelines of this nature a while back, and what we've seen in other states that have implemented similar guidelines is a gradual but definite reduction in the overall volume of opioid prescribing.
Governor, your administration received about a half a year ago $16 million grant from the federal government to focus on this. Has anybody studied actually what has happened in the last half year with that $16 million to see if you did provide more wraparound services and to see what the effect is, so that you would know whether to scale that up or scale it down?
Yeah, that's a good question. You're-
Hi, my name is Maria Bruni, and I'm the Acting Assistant Secretary for the Department of Human Services over Programs, and I'm the Acting Director of the Division of Alcoholism and Substance Abuse. I am the administrator who works on the Opioid STR grant, the one that you're referring to, which came out of the 21st Century Cures Act. We are administering that money. We're working very closely with SAMHSA on collecting, not only administering the programs that are funded out of the STR grant, but also collecting the data that's required from SAMHSA to be able to demonstrate that the multiple initiatives that are funded out of those grant dollars, what kind of impact they're having in terms of getting people into care. One of the big priorities is us working with hospitals to be able to have a warm handoff between people who are experiencing an opioid overdose in the emergency department, to be able to get them connected into care, so that we don't have people recycling in and out of our emergency departments having multiple overdoses. We are working with our county jails to be able to start medication-assisted treatment prior to release from county jail, so that, because we know that people upon release from correctional settings are at very high risk for overdose. So we probably have about 10 or 15 different initiatives that are funded out of the award. And we're working with SAMHSA on the data collection so that we can demonstrate through the first year of the award the impact that those services and programs are having.
Do you have any results of measuring this yet, any metrics? And if not, do you have a targeted date by which you would have that? And two, how much of the grant is left? And three, are you looking to the state or federal government to continue this program?
Yeah, there were lots of questions in there, so I'm going to try to remember all of them. I don't do this a lot. In terms of the last question, yes, we have received at least some initial information from SAMHSA that the second year of the award should be fully funded. So we're looking right now towards looking through what portion of the first year of the resources have already been spent and what remaining dollars we have for the first year, and then trying not to carry too much money over, but then also planning for how we're going to implement the second year of the award. When we applied for these grant dollars, we did have to do a 2-year budget, so we had to explain what all the programs and initiatives would be funding with the full 2 years of the award, because that was the intent from SAMHSA and HHS at the time. So we've been just going through and working on that. In terms of the we received the award we got the notice of award in February. We applied in February, but got the notice of award in May. So we are in the first 6 months of getting everything started.
Do you have any numbers as to how many citizens in Illinois have actually been reached by this program in the first 6 months?
Well, I know that one of the programs that we fund is helping local county health departments and local substance use treatment providers and other organizations be able to do the training to be able to administer naloxone and to be able to train first responders and actually to purchase naloxone for those first responders to use. I know that in the first 6 months of this grant, we've trained over 1,000 sites across the state of Illinois to be able to deliver naloxone to individuals, and I believe we've had over somewhere between like 8,000 and 10,000 individuals trained just in the first 6 months of the award.
Governor, there are a lot of addictions coming from long-time chronic illnesses, people being prescribed for chronic illnesses. Would you be interested in expanding the medical marijuana program for the state as an option for that?
That is a topic that's being discussed within the administration and with the various constituents as well as the legislature, and we'll see where those conversations.
There's discussion about opioid overdose, and is it part of that overall discussion of other ways to treat that?
I'll ask Dr. Shah or others to comment on that.
There are some interesting and preliminary data with respect to the use of medical cannabis as a substitute for opioids. As of right now, we are reviewing those data to determine what potential policy avenues could follow from them. It's also important to note that in addition to cannabis as a potential option, we now know from a study that was published in the Journal of the American Medical Association just 3 weeks ago that in an emergency room setting, good old Tylenol and Advil do just as well as opioids do. So we have to think about FDA-approved avenues as well as those involving medical cannabis, and we're contemplating all of those.
Can we get a little more information on this hotline? So has there never been a hotline until now, and is it up and working? And who are the people that will be answering the calls? And how then, perhaps, I get it that we're here today, but like people that might call 911, how are they going to get directed to this?
That's great.
Does anybody have any info on that? There's never been a drug hotline like this before?
There's never been a single number, so we've a lot of the numbers refer folks to the state of Illinois, to the Department of Human Services, to the Division of Alcoholism and Substance Abuse. We get probably anywhere from 40 to 100 calls a day, and those are we were only able to take those calls between business hours of 8:30 and 5 p.m. So we know that there's been an enormous need. Especially we've seen just the dramatic increase in phone calls that we get to our state Office of Alcoholism and Substance Abuse. Some treatment providers will have a 24-hour line. Most of those are, most of those have you have to leave a message though if you're calling after a certain hour. So we really wanted, when we were working with the opioid STR dollars that we received from SAMHSA, to be able to make a resource available for all Illinois citizens that would be available 24 hours a day, 7 days a week. My name is listed on the SAMHSA locator for their website. I get probably 10 to 15 emails over every weekend for people who are desperate to find help, and so it's really it's great for us to be able to refer folks to the line. And no one said the number yet, but it's 1-833-2-FIND-HELP. So we're hoping that everyone will walk away remembering that number. It's 1-833-2-FIND-HELP. The people who are answering the calls are trained call takers who the company that's doing it set up the same sort of helpline in the state of Massachusetts, and the call takers are trained in an evidence-based practice called motivational interviewing. So they start with where the caller is starting from. There's not a script. They will treat every caller as a unique person with a unique set of strengths and weaknesses and problems, and they will respond to everyone individually. This is not a scripted format that the call takers follow. And again, this is the first time we've had a full statewide helpline.
And is it up and running?
Yes, it is up and running. We've been testing it out over the weekend. So starting on Friday, we started forwarding all the calls that were coming into our DHS DASA office, and we've had some really great feedback so far over the weekend, but we're hoping after today that there will be a flood of calls. Our call takers are all trained and ready, and there is a bank of them who are all ready to take the calls from everywhere in Illinois.
Are there even enough slots at substance abuse treatment centers to treat everybody that has an issue? It was decimated, it seems, from what the people that I talked to over the budget impasse. Is that back up and running, or are we going to have people calling a hotline and nowhere for them to go?
I'm not going to say that access to care isn't an issue, and I'm not going to say that it's not an issue, especially in certain areas of the state where there may be fewer providers. I will say, though, that sometimes people's perception about what they need can be not exactly what they think. So sometimes when we think about treatment, we think about residential inpatient stays, and there are lots of outpatient programs that are treating people effectively, and there's lots of medication-assisted treatment providers. There are physicians that are prescribing buprenorphine and other medications that have been found to be effective in treating substance use disorder, and coupling them with referrals to outpatient counseling services. One of the parts of this helpline is that the call takers are trained in the addiction, the association, the Association for substance use medication, to be able to place people in the right level of care, so that people they'll do an initial screening and an initial assessment that'll really try to match them with the right services they need. So rather than just people trying to call different numbers and try to find out which is the right setting for them. So yeah, there are issues with access to care, but we're also knowing that this will help place people a little bit easier and in the right setting for them. My name is Maria, and the last name is Bruni, B-R-U-N-I. Yeah, yeah, the regular.
I don't know, either governor or director, what is being done about this access to care issue? Do you plan to do money? I believe money for drugs. And the governor, I believe that was part of your cuts for this year's budget. There were cuts as well too.
Yeah, I can take that a little bit, only because we work on this quite every day. We have also been working very closely with SAMHSA and with HHS. There are numerous opportunities for federal resources that we're bringing to the state. In this last fiscal year, my division, and I know that there's resources that IDPH has brought to the state too, but my division, the Division of Alcoholism and Substance Abuse, has brought in over $40 million of federal funding for specifically targeted the opioid crisis. With those dollars, we're able to really look to see where we have gaps in services. We've done a mapping of where all the treatment availability is throughout the state, and we're now entering into really trying to improve access to care in in areas of the state where, especially for medication-assisted treatment, where there's a lack of some of those resources. So all of this is being done in a very, we're trying to be very thoughtful with these dollars, but we're knowing that we're using them to supplement some of the gaps in services that we've seen, not just recently, but throughout history in the state, where we've had some service deserts for a long, long time.
Luke, I know it's difficult for you to speak, but I think you had a very powerful message. Could you tell us about whether or not you think this hotline will be helpful to others facing the same kind of issues that you face?
I think that this is a tool that can be used. You've seen for the last several years grassroots groups built by mothers and families who have lost their children, raising awareness of this issue, and there hasn't been much action taken. And I view this as a tool, that people can use, but it's just a tool of the many that are needed. So, I think it's a good start, and I just hope that the state and the federal level take this issue seriously. So I'm just glad to see something being done.
Can you spell your last name, please?
My last name is Tomsha, Tomsha.
Say how your addiction started 14 years ago.
Yeah. I didn't find satisfaction in my career. And there was nothing in my career that I really enjoyed. I was in IT, I was good at it, but I didn't enjoy it. So after work, I would get wasted with friends, getting drunk. It led to harder things. It led to opiates. And from there, it became a vicious cycle. So when I finally got out, 14 years later, I decided to give up everything and not pursue a career in IT and find something that gave me purpose, where I would get more happiness and satisfaction in my career, so I wouldn't turn to drugs and alcohol for my happiness.
Was it expensive to support that habit? How did you do that all those years?
It was extremely expensive.
How were you able to finance that?
I worked 3 jobs. I spent nearly $5,000 a month at its peak. And It's nothing I'm proud of. But as you move forward in your addiction, your tolerance gets bigger and bigger, and you will feed it at any cost. And you see that with people's homes getting broken into. You see people taking drastic measures just to feed this addiction, behavior that you would never expect out of certain individuals, including myself. I would have never thought in a million years I'd be standing up here, but I am. So, okay.
Thank you. Are there other questions on this issue? Again, thank you. Thank you for your focus on this critically important. Again, I'd like to highlight for everyone with the cameras and everyone, 1-833-2-FIND-HELP. Call in 1-833-2-FIND-HELP. Also, ending opioid misuse, go to #EOM, #EOM. We want to communicate and share and get help on a prompt basis, and that's what this is about.